When I look at where we are with regard to comparative effectiveness research, my bottom line is so far so good. I'm pleased with the legislation that was passed. I think it had the right key elements. It's beginning to move along. The Board of Governors was just announced by the GAO last week. But I think it's still very fragile. And it will remain fragile for a number of years until people begin to see how important and useful comparative effectiveness research and don't regard it as the threat that some people regard it now. People sometimes ask me, do I worry that the information might be misused, might be used to keep people from gaining access to new drugs or devices or medical procedures? My response is, you don't need information to make bad decisions. We can make bad decisions all on our own without information. What comparative effectiveness research ought to be able to do is to help inform clinicians and patients, and ultimately payers, about what's likely to work best for a particular subgroup of the population that has some symptom set or some medical condition. That's terrific information. Could it be misused? Well, of course it could be, but as I've said, we've seen in years past that payers or clinicians or patients can make bad decisions with or without good information. The issue about dissemination and communication is going to be key. There was some money that was set aside in the initial funding by the stimulus bill for the department, which I hope will be used to disseminate the information. I think all of us who are interested in comparative effectiveness research had a real wake-up call with the media and public and clinicians' response to the report on mammography that occurred last November when the Preventive Services Task Force released their new report. It indicated how key it is to be careful people understand what you're saying and why you're saying it, and that the information is disseminated widely, and that the people who are going to be most effective have been brought in to feel like they've had a chance to share their input on something emotional and on something important to them. Didn't happen well with the mammography guidelines. It needs to happen, particularly if the results are going to be controversial and against conventional wisdom. The PCORI, the Patient-Centered Outcomes Research Institute, is just in its very beginnings. The directors or Board of Governors has been named. They need to pick a very competent but politically savvy executive director. They're going to need to have good senior staff. And they're going to need to get busy right away. The GAO will need to appoint a methodology committee. We'll have 18 months to report back on what defines credible evidence. This is going to be a very important report. It has to appeal to the scientific community, but it's going to need to make sense for patient advocates and clinicians as well.